The top stories tonight in Y News. The Philippine government targets to drop the COVID-19 cases in the country by 25% in 2 weeks under the NCR Plus bubble.
The Department of Health confirms that 2 more contagious COVID-19 variants found in South Africa and the United Kingdom have already spread in Metro Manila.
All private companies can now procure COVID-19 vaccines together with the national government. The Philippines filed a diplomatic protest against China after more than 200 Chinese vessels were sighted in the West Philippine Sea.
Largest asteroid of 2021 to make closest approach to Earth.
And a company offers to pay $2,400 to someone who can stay away from their gadgets and screens for 24 hours. Good evening, Philippines and the world. Today is Monday, March 22, 2021. I am Harleen Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news. The national government has imposed additional restrictions in Metro Manila and 4 neighboring provinces amid the rising cases of coronavirus disease 2019 in the country. Described as the National Capital Region Plus bubble, only essential travel is allowed into and out of the bubble. With this, the government aims to reduce the COVID-19 cases by 25% in 2 weeks. Rosa Licos explains why.
The National Capital Region Rizal, Cavite, Laguna, and Bulacan will undergo strict general community quarantine or tagged as NCR Plus bubble from March 22 to April 4. Non-essential travel to and from NCR Plus is not allowed. However, the government clarifies that movement is not restricted within the NCR Plus bubble.
So tandaan po natin na within the bubble, the movement is not restricted. It is only when crossing the border na yun ang ating babantayan.
Aside from the travel restrictions, mass gatherings which include religious gatherings are also prohibited. As for dining, only outdoor dining will be allowed in 50% capacity in areas under GCQ, while indoor dining will be strictly prohibited. Through this, the government eyes to reduce the daily COVID-19 cases by 25% in 2 weeks' time. Apart from this, the government is appealing to the public to stay at home as much as possible.
Ang target natin, minimum 25% reduction. But we're hoping for more. Kaya nga po, dinadaan na rin natin sa pakiusap. No? Bagamat hindi po kayo pinagbabawalan na lumabas sa inyong mga tahanan sa loob ng NCR Plus bubble, sana po, kung hindi naman kinakailangan lumabas, ay manatili na lang po sa ating mga tahanan. Kasi ang nais natin, mas malaki pa sa 25% po ang mabawa sa mga kaso.
According to the palace, the spike of cases in the country is because of the existence of new COVID variants, low masking compliance, super spreader events, mass gatherings, reduced surveillance, reduced contact tracing, and delayed testing. Meanwhile, gyms and spas will be allowed to operate in limited capacity within the NCR Plus bubble. Gyms can still operate up to 75%, while spas will be allowed to open up to 50% operating capacity. However, local government units also can order to suspend their operations. Rosa Licos, UNTV News and Rescue. We serve the people, we give glory to God.
The Philippine National Police has implemented a strict border control in strategic areas in Bulacan, Cavite, Laguna, and Rizal after the 4 provinces were placed under strict general community quarantine. Leia Ilagan reports.
Some motorists in Marcos Highway, Marikina were apprehended in a checkpoint for not wearing a face shield. This after the Philippine National Police enforced the border control by establishing checkpoints inside and outside the boundaries of Metro Manila, Bulacan, Cavite, Laguna, and Rizal. The areas are placed under general community quarantine from March 22 to April 4 to limit the spread of coronavirus infections.
Usually, mga violation yan, hindi nakarehistro. Sa pangkaraniwan, walang lisensya. Tapos, no social distancing, tapos walang face shield. Confiscated po ang license sila sa Marikina po sila tutubos. Yung walang helmet, 500. Yung mga walang rehistro, 1,000.
Some motorists are in favor of the new restrictions to ensure that the people are strictly following the health protocols against COVID-19.
Okay naman yung ng checkpoint. License pati yung company ID, ma'am.
Isang beses lang checkpoint eh.
Saan ka galing?
Hindi po
Ano hinahanap ko mo?
Ano lang, lisensya lang, binigay ko ng ID. At tinanong ko saan pupunta. Okay naman, walang problema.
PNP spokesperson, Police Brigadier General Ildebrandi Osana says they are implementing a stop-and-go scheme or random checkpoint to avoid long traffic.
In general, ma'am, pagdating sa checkpoint, stop and go lang naman po yan. Titignan po yung minimum health standards na sunod po at kailangan pakitaan ng ID. Okay na po. Pero kung ito po sa konteksto ng bubble, hindi naman po kailangan na mag-impede sa ngayon kung sila po ay nasa within the boundaries ng NCR at yung karating na probinsya ng Rizal, Laguna, Cavite at Bulacan.
Osana adds some LGUs are implementing stricter health protocols. That's why the police are asking motorists to present their company ID to ensure that they are essential workers. Leia Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
Meanwhile, the Octa Research Group observed that the transmission of COVID-19 in the country has become more rapid. To prove what the group said, the reproduction number last week increased over the weekend. Joan Nano tells us why.
As the number of new COVID-19 cases in the country continue to surge, exceeding the highest number of cases recorded last year, the Octa Research Group reported that as of today, the reproduction number of the virus has increased to 2.07 from only 1.9 rate last Friday. This means that one positive patient may infect two or more close contacts, implying that more new cases is expected on the coming weeks. Based on the study of Octa Research Group, the spread of the COVID-19 variants is one of the main drivers on the surge of COVID-19 cases, particularly in Metro Manila, Bulacan, and Calabarzon region.
There is momentum on the side of the virus. It's spreading very quickly, and right now it's very hard to slow down we can slow down the momentum of the virus, but right now it has a very strong upward push. I believe most of what's spreading in the other regions, the Calabarzon and Bulacan, are also driven by the variant.
Although a week had passed since the implementation of unified curfew hours, granular lockdowns, ban on minors to go outside and other ordinances, the research group says they are yet to see the impact of these measures to slow down the reproduction number of COVID-19.
We did not see a strong downward push based on these. In fact, late last week during the media forum, we mentioned that the reproduction number decreased slightly. I think it was around 1.9 or 1.95 at that time. Pero after this weekend with big numbers, tumaas ulit to 2.07. So it's not the desired effect that we were hoping to see.
Octa still projects that new COVID-19 cases may reach to 10,000 daily by the end of March, where 5,000 of the cases will be seen in Metro Manila. Experts say that the surge in COVID-19 may persist to 1 to 3 months, resulting to hospitals reaching their critical capacity. The Octa Research Group reiterates that they are not telling this to alarm the public, but instead emphasize that these data are based on science and are proven even during the start of the pandemic last year. Joa Dano, UNTV News and Rescue. We serve the people, we give glory to God.
The Department of Health, or DOH, reported today 8,019 new coronavirus disease 2019 cases, another record high. This brings the total number of cases to 671,792. Of the said figure, 80,970 are active cases. Of the active cases, 95.4% are mild cases, 2.2% are asymptomatic cases, 0.9% critical cases, 1.0% severe cases, and 0.52% moderate cases. The DOH case bulletin also showed 103 new recoveries, bringing the total number of recoveries to 577,850. As to the number of deaths, 4 new deaths were recorded, which means that there are now a total of 12,972 fatalities due to COVID-19. Meanwhile, data from the health department showed that 336,655 healthcare workers have been vaccinated in 17 regions as of March 20. It added that 1,105,600 out of the 1,125,600 doses, or 98.2% of the donated Sinovac and AstraZeneca vaccines, have already been distributed. The DOH said that the vaccination pace will soar once bulk of vaccines come in for the next priority groups. Healthcare workers remain the topmost priority in the government's national COVID-19 immunization program.